This recording will go over mass casualty triage. So let's start with the term triage. Just a reminder of what triage means. It's the process of sorting or classifying patients into priority levels depending on illness or injury severity. And 99% of the time when we talk about triaging and who's your priority patient, we've talked about basically the patient who's going to die first is your highest priority. That prioritization changes when we have disasters or mass casualty situations. And this is actually a topic noted in the NCLEX test plan that may be tested over. So you want to be familiar with mass casualty triage. So let's look here when we're triaging people during a mass casualty or disaster. So this could be, when we're talking about mass casualty, what we're saying is the number of injured or the number of casualties greatly exceeds the resources available to treat or take care of these patients. So mass shootings, 9/11, environmental emergencies, floods, hurricanes, those types of things. If it's something where multiple people are injured and killed, and the number of people injured or killed exceeds what the hospitals in the nearby area is able to provide for those patients, that would be considered a disaster. And a lot of these hospitals have policies and procedures related to disasters, and they go through mock disaster responses to make sure they're prepared in the case of a disaster. But we're going to focus on these mass casualty triage rankings. So first classification here is red or emergent, and these are patients who need immediate attention. Next, yellow, the patient can wait a short period of time before care. Green is non-urgent, also known as the walking wounded, so not, the injuries aren't too severe. And then finally, black, patients who are tagged black are expected and allowed to die or are already deceased. So the four classifications for a mass casualty event: red, yellow, green, and black. Now remember, normally someone who's expected to die, maybe whatever it is they have going on, you think this person out of the four is the first person that's likely going to die. Normal prioritization, we say that's my priority patient. But when, imagine yourself, you the nurse, and you're surrounded by hundreds of people who need assistance, right? So the resources, including human resources, aren't enough to meet the needs. That's when we have to figure out, well, who do we need to spend time with as a person, and who are we going to use our resources with? So black are patients that are expected and allowed to die. So with mass casualty triage, patients who are tagged red are our priority, our first concern. So let's list some things that would cause a person to receive the red tag. And the system for mass casualty triage, red tagged patients have immediate life-threatening conditions such as airway obstruction or shock and need immediate attention. Yellow tag patients, that's our second priority there. Yellow tag patients have major injuries such as open fractures with pulses and large wounds, and ideally would get treatment within 30 minutes to 2 hours. Green tag patients, also known as the walking wounded, have minor injuries that can be managed after a delay of even more than 2 hours. They include closed fractures, sprains, strains, abrasions, and contusions. Then finally, black tagged patients are those with massive head trauma, extensive full-thickness body burns, and high cervical spinal cord injuries necessitating mechanical ventilation. So it's saying if I have a high spinal cord injury that affects my ability to breathe, I can't have one person using a mask on me to ventilate me when there's hundreds of other people that need assistance. In mass casualty or large-scale disaster situations, using this form of triage is good because it provides the greatest good for the greatest amount of people. So when people ask, well, how could you just expect or let someone die who's had that high cervical spine injury? And the goal, again, is not to treat who's going to die first, but how treat these patients and classify them so that you can do the greatest good for the greatest amount of people. We don't want to be ventilating a patient, right, when we have 6 other patients who are red tagged who may die because we're not paying attention to them. That's the thought behind it. So let's give you some examples and see if you can think which color tag you would put on your patient. Okay. So you can pause the video to read the questions if you need to, and then resume. So for this patient, they are a green tag patient. Having a closed fracture would make them considered to be the walking wounded or non-urgent. They would receive a green tag. This patient would receive a yellow tag. They would have an open fracture, but they still have pulses, so that's a good sign. For that reason, they'd receive a yellow tag. This patient would receive a black tag. After having massive head trauma, or it's being described what lets you know massive head trauma would be triaged as a black tag patient. And this patient would receive a red tag. Patient with airway obstruction would receive a red tag. The hope would be that we could deal with the obstruction and they'd be able to continue breathing. This patient would be a green tag patient. Patients with sprains or strains would be green tag. This patient would be a red tag patient. Patients experiencing signs and symptoms of shock would be red tag. And finally, this patient would be a black tagged patient. Patients with extensive full thickness body burns would be considered black tagged.